What if one supplement could make your entire immune system smarter? Not stronger, in an aggressive way, smarter. That's exactly what BWH85 beta-glucan from BWH Labs does. It works with your immune system, helping it recognize threats, respond effectively, and protect you the way nature intended. BWH Labs has spent over 25 years perfecting the purest, most biologically active beta-glucan on the market, an 85% pure formula that's been tested against 200 competitors and named the most effective immune modulator in peer-reviewed research. The science speaks for itself, just one ingredient, one focus. Unmatched results. Doctors and integrative health practitioners trust BWH85 beta-glucan, and so do I. It's available in 100 milligrams for daily support or 500 milligrams for maximum immune defense. It's only available through health practitioners, but as an intelligent medicine listener, it's available to you through my full script dispensary. Just go to drhoffman.com/BWH for more information and to order. That's drhoffman.com/BWH. Because a smarter immune system starts with one smart choice.
Welcome to Leyla Muedin. I'm your host, Leyla Muedin. I am a registered dietitian nutritionist here in New York City, and I'm available for consultations via in-person, telephone, as well as virtually via telehealth. If you're interested, the number to call is 212-779-1744. The email for questions that you'd like to hear answered here or have me take a deep dive on, weigh in on, is questions@drhoffman.net. That's questions@drhoffman.net. So I wrote recently about MTHFR, which is a genetic mutation. And I'm going to give you a little overview of that article because I have a question then related to this. Let me read you the question first. This is from Richard. I just read your article on MTHFR variants and applications to reduce homocysteine with personal interest. I do have the 677 variant and have high homocysteine levels and borderline MMA levels, which are not responding to the nutrients at high levels that were in the article. Any thoughts on how to manage lowering the levels substantially? So for all of you, MMA is methylmalonic acid. It's another marker of B12 status. But MTHFR stands for methylene tetrahydrofolate reductase, MTHFR. It's a polymorphism, meaning it's a genetic mutation. Now, this first gained attention over a decade ago, and many integrative practitioners, even regular doctors now, are picking up on this. They would test for this in the setting of cardiovascular risk factors like high homocysteine levels. It's almost a proxy, high homocysteine levels that somebody may have this particular mutation, this polymorphism, because high homocysteine is a proxy for methylation status. Also, it may impact mood issues, anxiety and depression, migraine, and vitamin deficiencies like B12 and folate, and subsequent symptoms related to that, as well as pregnancy complications that may be associated with it. Now, it's worth noting that many people with this genetic SNP stands for, SNP stands for single nucleotide polymorphism, just another way to say mutation. It's worth noting that many people with this genetic SNP, they don't have any symptoms at all. And the variants of the SNP, of the mutation, are C677T, which is what Richard has, and A1298C. Some have one variant, making it heterozygous. Others have both, making it homozygous, a double hit. SNPs and enzymes like MTHFR impair methylation and the remethylation of homocysteine to methionine, reducing SAMe, which is a critical methyl donor. Now, the standard advice among integrative and functional medicine practitioners is to recommend the methylated versions of folate and B12 and to avoid folic acid fortified foods. Vitamin B6, choline, and are cofactors in the methylation pathway, and these are of added benefit and often added to homocysteine lowering formulations. Now, there is a caveat. There is a subset of people who feel worse on methylated B vitamin formulations, and this may have to do with other genetic SNPs that they may have, like COMT or DRD or other things downstream from the MTHFR SNP or coinciding with. It's all there at the same time, so it's really semantics, right? Anyway, these people, they report when they take the methylated B vitamins, which have been suggested in order to deal with their high homocysteine, they report feeling increasing anxiety and irritability and even anger or quick temper. And this observed intolerance is more prevalent than we knew about a decade ago. And those individuals, they do better with the standard B vitamin formulations. So, contrary to popular belief, and many scientists at this point agree, the non-methylated formulations still help with lowering homocysteine and addressing all the issues associated with low B vitamin status. Now, again, Richard writes that he does have the C677T variant and has high homocysteine with borderline MMA levels which are not responding to the nutrients at high levels. So any thoughts on how to manage lowering the levels substantially? Now, let's first talk about homocysteine levels. Richard doesn't give me what his homocysteine level is, but in normal lab ranges, over 15 is high, is quite high. In our integrative and functional medicine and nutrition circles, we say over 10 is quite high. We like to see it under 10. Optimally, we like to see it under 8. And other practitioners who are, into the research with Alzheimer's and dementia, like Dale Brederson, he says homocysteine should maybe be under 5. So that's interesting. Now, there are some people with very high homocysteine, like Richard, who aren't responding to the B vitamins, and he's probably not responding to the methylated B vitamins either. So what else may be happening is that there are other conditions, there are other causes for elevated levels of homocysteine. And over the past 20 years, there has been a great deal of research examining the relationship between mild to moderate elevations in homocysteine and MTHFR mutations and the risk for cardiovascular disease and blood clots as well. There are other causes of elevated homocysteine besides a deficiency of folic acid, vitamin B6, and vitamin B12. The genetic abnormalities, which is the topic of this podcast, the MTHFR mutations. But, Richard, and all of you listening out there, low levels of thyroid hormones, hypothyroidism, is a reason for homocysteine levels to remain high. So first order of business, Richard, make sure that you don't have hypothyroidism or even subclinical hypothyroidism, meaning you're not exhibiting any of the symptoms, but on lab tests, your levels are kind of showing lower or in the lower normal ranges, which may be the beginning of something that may be contributing to your high homocysteine that is not responding to the micronutrients you're taking of folic acid, B12, B6, right? Another reason for high homocysteine is kidney failure. And there are other chronic conditions and diseases that contribute to high homocysteine, such as obesity, high blood pressure, diabetes, smoking, physical inactivity. And if you're on particular medications like statins, like Lipitor, atorvastatin, methotrexate, which is in autoimmune diseases, it's an immune suppressor, methotrexate, and fenofibrate, these medications, these may be reasons why your homocysteine is remaining elevated. So another thing, Richard, if you haven't already, those with high homocysteine where they were getting some benefit from B-complex formulas and helping to lower the homocysteine, but not low enough, you may benefit, if you haven't tried already, try taking SAMe, because SAMe is a critical donor. It's a critical methyl donor. And you have to make sure that you're reducing your toxic burden anywhere in your microenvironment, because there are modifiers of all of that. So, and again, there are other gene SNPs, COMT, for example. Some people with the COMT variant, which is also magnesium dependent, they may have trouble with the methylated forms of B vitamins. And without getting too far into the weeds, I'm not suggesting that everybody go get a genetic study done or anything like that. Sometimes the answer can be rather simple. Rather than taking the methylated versions of the vitamins, you just stay with the standard, right? Or the other way. You could try either or both even, maybe even both. You could start taking SAMe. You can increase your level of trimethylglycine in a separate formulation. Maybe you need more trimethylglycine. Are you on any of the medications that I just mentioned, atorvastatin, methotrexate, fenofibrate? Are you in any stage of kidney failure? Do you have hypothyroidism or low thyroid hormones if you're not already exhibiting the symptoms of hypothyroidism? So, Richard, you need to get all of that checked out. So that's one thing. There certainly maybe there's something else going on in your gut, because you say that you have borderline MMA levels, borderline methylmalonic acid, meaning you may have some trouble absorbing that B12 that you're taking, whether regular B12 or the methylated methylcobalamin, right? It's possible that you're low in intrinsic factor. We do secrete less intrinsic factor as we get older, and that is necessary for processing and absorbing B12 in the GI tract. So, Richard, there are other places for you to look in terms of that. So, other things, there are also, you need a full assessment from a qualified nutritionist to look at everything that's going on with you. And some people do just have, no matter what they do, and this is quite a minority of people who just continue to have high homocysteine no matter what we've done, which nutrients we've thrown at it. They're not on these medications. They're not obese. They don't have hypothyroidism. They don't have diabetes or high blood pressure. They don't smoke. They're not physically inactive. All of the above. They may need yet higher, even pharmacological levels of folate. This might require a prescription. But first, I would say to you, to Richard, and to anyone else in this dilemma, similar to Richard's, increase the trimethylglycine. Start taking SAMe and wait a few months, 2 to 3 months. Get your homocysteine checked again. If this still isn't doing it, and everything else has been checked out for you, you may benefit from a pharmacological dose of folate that you will inquire with your integrative doctor about, your practitioner about. So that might be something, because that's something that would also need to be watched. So homocysteine, high homocysteine is a proxy for whether you're methylating well or not. And that's really what it's about. Now, moving on, and thank you for that question, Richard. I want to go on to something else, because high homocysteine is also a risk factor for dementia, for stroke, all of that. There's a study that shows vitamin C status linked to measures of healthier brain aging. Now, could something as simple as vitamin C help support a healthier aging brain? In a study of more than 2,000 older adults in Japan, researchers found that people with lower vitamin C levels in their blood also tended to have less gray matter and weaker connections in a key brain network involved in memory, attention, and other cognitive functions. The findings were published by researchers from Haruka Nagaya of Hirosaki University in PLOS One. Earlier studies have suggested that people who consume more vitamin C are less likely to experience cognitive impairment as they get older. However, little research has examined whether vitamin C levels measured directly in the blood are associated with physical changes in the brain. To investigate that question, the researchers analyzed MRI scans and blood plasma samples from 2,044 Japanese adults over the age of 64. Using the MRI scans, they measured the volume of gray matter and white matter in each participant's brain, while accounting for differences in overall brain size. They also examined connectivity within the default mode network, a group of interconnected brain regions that plays an important role in attention, in autobiographical memory, as well as other cognitive functions. So they found lower vitamin C linked to smaller gray matter. Now, after adjusting for factors that can also influence brain health, including age, education level, physical activity, the researchers found a consistent pattern. Participants with lower plasma vitamin C levels tended to have reduced gray matter volume and weaker connectivity within the default mode network. The results suggest that maintaining healthy vitamin C levels could potentially help support cognitive function and healthy brain aging. However, the researchers do emphasize that this was an observational study, meaning it cannot determine whether vitamin C directly causes these differences in brain structure or function. More research will be needed to uncover the biological mechanisms behind these statistical associations. Now, one of the study authors stated, quote, "Our study demonstrates that higher plasma vitamin C levels are associated with better preserved structural connectivity of the default mode network, a key brain network involved in cognitive function. The finding generates the exciting hypothesis that a diet rich in vitamin C might play a supportive role in maintaining brain health and mitigating age-related cognitive decline in older adults. The researcher continues to say, quote, "What I found most fascinating about this research is that we were able to detect these subtle but significant associations between a single nutritional factor and large-scale brain networks by utilizing a robust community-based cohort of over 2,000 older adults. It truly highlights the potential impact of our everyday dietary habits on our brain structures." Absolutely. Absolutely. It is true. So, one of the things that even if I run out of some of my other supplements, and I get a little remiss in reordering in a timely manner, I make sure I'm never running out of vitamin C. But, vitamin C is also easy enough to get, from your strawberries, your oranges, your other fruits and vegetables, red peppers in particular. These are all good, but also you need to remember that vitamin C is also diminished, not just by not enough dietary intake and not, eating lemons and limes and all of that, citrus. You have high blood sugar. High blood sugar competes with vitamin C. So you want to make sure your blood sugars are in the normal level. This is also important in vitamin C status. I want to thank you for joining me on another edition of Leyla Weighs In. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.